Today, we are discussing a serious neurological condition known as amyotrophic lateral sclerosis, or ALS. ALS is a progressive neurodegenerative disease that affects nerve cells in the brain and spinal cord. It is often referred to as Lou Gehrig's disease, named after the famous baseball player who was diagnosed with it in the 1930s. This condition leads to the gradual degeneration and death of motor neurons, which are responsible for controlling voluntary muscle movements such as walking, talking, and swallowing. As these neurons die, the brain can no longer initiate and control muscle movement, leading to muscle weakness, paralysis, and ultimately, respiratory failure. The exact cause of ALS remains largely unknown, though several factors may contribute to its development. Research suggests that genetics can play a significant role, with around 10% of cases being familial, meaning they are inherited through family genes. In these cases, mutations in genes such as SOD1, C9orf72, and TARDBP have been implicated. The remaining 90% of cases are categorized as sporadic, with no clear familial link, yet certain environmental factors like exposure to toxins, intense physical activity, and even previous viral infections have been proposed as potential risk factors. Symptoms of ALS vary from person to person but generally begin with muscle weakness or stiffness. Initially, individuals may notice difficulty in performing everyday tasks like buttoning a shirt, climbing stairs, or holding objects. As the disease progresses, muscle wasting occurs, and patients may experience twitching or cramping in the affected muscles, known as fasciculations. Speech can become slurred, leading to issues with communication. Swallowing may also become challenging, resulting in concerns about aspiration and nutritional intake. Importantly, while ALS affects motor function, cognitive abilities may remain intact. However, some individuals may develop frontotemporal dementia, which can affect behavior and personality. Diagnosing ALS can be complex. There is no single test that can confirm the disease. Physicians typically conduct a thorough medical history and physical examination, followed by a series of tests including electromyography, MRI scans, and blood tests, to rule out other conditions that may mimic ALS symptoms. The process can take time, as neurologists strive for an accurate diagnosis. Currently, there is no cure for ALS, but there are treatment options that can help manage symptoms and improve quality of life. Medications such as riluzole and edaravone have been approved to slow the progression of the disease and extend survival in some patients. Supportive care through physical therapy, occupational therapy, and speech therapy plays a crucial role in maintaining mobility and communication abilities. Assistive devices, such as wheelchairs and communication aids, can help individuals manage daily tasks. Moreover, multidisciplinary teams involving neurologists, nurses, dietitians, and social workers are essential in providing comprehensive support for ALS patients and their families. Living with ALS can be emotionally and physically challenging, not just for those diagnosed but also for their loved ones. Psychological support through counseling and support groups can be invaluable for coping with feelings of anxiety, depression, and loss. Many organizations, including the ALS Association, work tirelessly to raise awareness, fund research, and provide resources for patients and families. As we move forward, research continues to explore new potential therapies and interventions. There is hope that advancements in genetic research and biotechnology will lead to better treatment options in the future. Ongoing studies aim to provide more insight into the mechanisms of ALS and identify new drug targets that could slow down or halt disease progression. In summary, ALS is a devastating disease that requires a comprehensive approach to care, support, and ongoing research. Awareness of this condition and its symptoms can lead to earlier diagnosis and intervention, which is critical for improving the quality of life for those affected. Thank you for joining us as we shed light on ALS, and let's continue to advocate for those affected by this challenging condition. If you found this video informative, please consider liking, sharing, and subscribing for more educational content on important health topics.